Hi everyone, my name is Katie and this is my career speech. I'm sure most of us want to help people some way, somehow. You can become a teacher, a paramedic, or even an entertainer. I personally want to become a nurse and have known that ever since the age of 10. And it all happened when at a family wedding, one of my cousins had fallen unconscious and he wasn't responsive. And my aunt, who's a nurse, decided to perform CPR on him. And that CPR is what saved his life. And in that moment, I knew I wanted to be just like her. Currently, I'm a freshman at Highline College and I'm taking my prerequisites for pre-nursing. And after I finish my prerequisites, I intend to transfer to a 4-year university to acquire my BSN. And my top choice is Seattle University. And I chose Seattle U because of its size and the location of the school. And since I have to transfer to a nursing school, I'm considered a transfer applicant. And to be a competitive applicant, not only do I have to maintain a high GPA, but I need to have extracurriculars as well. Currently, I've been a volunteer at my church for the past 4 years as a catechist, and I'm volunteering at 2 different hospitals in the emergency department. And in summer, I plan on taking my certified nursing assistant program in order to work as a nursing assistant in a hospital or a nursing home. And when I do become a registered nurse, I would love to work in the emergency department or the peds department. Now that we've established what my personal pathway is, let's discuss some of the other pathways that you can take. So the first one is the traditional route. And let's use Seattle University as an example. So when you apply to Seattle University's school as a freshman, that's when you can declare your major. So when you declare your major as nursing, they'll let you take the prerequisites for the nursing. So that's your first 2 years. And if you maintain a GPA of 3.0 or higher, you're automatically admitted into their nursing program. So that's when you can take the actual nursing courses. And that's junior to senior year. And during your junior and senior year, that's when you do your clinicals. And for Seattle U, they do their clinicals at both Swedish hospital campuses as well as the UW hospital. And it's also recommended that you can't take other courses because nursing workload is heavy. And after those 2 years of nursing classes as well as clinicals, you can take your NCLEX exam to be certified as a registered nurse. The second route is the associate degree of nursing, and that differs from the BSN because it only takes 2 years, which a lot of people do take. And it's a degree that Highline offers as well. But a lot of people, after getting their ADN, they transfer to another school to get their BSN because having a BSN not only earns you more money, but it also makes you a more competitive applicant for hospitals. But they both have similarities where all nursing students have to take the NCLEX as well as do clinicals. Now that we talked about what routes you can take, where can you work? So the most popular place to work at is a hospital. But you can also work at nursing homes, clinics, become a home nurse. There's a bunch. In my personal experiences, working as a nurse in a hospital and a nursing home are 2 completely different things. In a hospital, nurses are always running around because they have so many things to do. They have a lot more patients. In a nursing home, the CNAs, the nursing assistants, do most of the work. They're in charge of changing them, feeding the residents, bathing them, all of that. But the nurses, the registered nurses, they're in charge of giving medication and basically most of the paperwork. And compared to a hospital, nurses in the nursing homes, there's only about 2 on a shift. And what can nurses do? They can basically administer medication, not prescribe. They're two completely different things. Change dressings and insert IVs, and they also do a lot of transporting as well. But depending on what department you work in, the jobs that you have will vary. Now let's talk about salary. And according to Glassdoor, nurses who work in Washington earn about $86,662 a year, and that's 13% more than the national average. Compared to Iowa, they only make about $61,287. So as you can tell, that's a big difference. So depending on where you live, that's how much you'll make. In conclusion, nurses are extremely important in healthcare because that's what keeps it running. Without nurses, a lot of the jobs would not be done. And they do many things. And like I said, salary depends on where you live, and Washington and California have one of the highest salaries. And nursing is highly competitive to get into, and I really hope that I get in. So thank you for listening.